is an online meeting. Can I remind everyone that this is webcast and recorded? And if during the meeting you wish to speak, could you put something in the chat bar or put your hand up? I'll try and move between the two. I'm having trouble seeing either at the moment, but colleagues I'm sure will help me. Could I ask all attendees, except board members, to switch their cameras off, please? Apart from when one is about to speak, if you would then put your camera on at that point. Only board members should have their cameras on. So, Jenny, could I ask, have we any governance? Have we any apologies or substitution?
We've got apologies from Mel Meggs.
Okay, thank you. Is anybody else aware of any substitutions? Anybody here substituting for anybody else that we don't know about?
Not been notified of any, Chair.
Okay, thank you. So if we move to item 2 then, please, the minutes of the last meeting. I don't know if anybody has any corrections that they wish to make or any comments from that. I'm not seeing any indication. Can I therefore ask, are these accepted as a true record of the minutes of the last meeting held on the 20th of January? Okay, I think so, yeah, thank you. Can I ask it as well that if any members have an interest to declare, you complete the form that's in your pack, and please make sure it gets to Jenny as soon as possible. All the items on this agenda are to be held in public. So if we move to item 5 then, Jenny, have we any deputations or petitions?
None received, Chair.
Okay, thank you very much. So then moving on to item 6, this is a COVID-19 update. It's a verbal update, and I'd like to welcome Rachel Spencer Henshaw, who is going to give us that. Over to you.
Thank you so much, Councillor Kendrick, and nice to see everybody. It's probably quite an interesting time to be coming to the Health and Wellbeing Board, because there's quite a significant set of changes that come into effect today, obviously beginning then in April. So as of the end of today, there will be an end to the existing requirements around self-isolation and vaccine passports, and there will no longer be universal free lateral flow testing across the country. So we've done some communications today in terms of how we can support people going forward to kind of live safely with COVID. I normally present data, but I wasn't going to do that today, and that's largely because with the requirement to legally self-isolate that was removed earlier on in the year, and then the fact that we didn't have PCR testing and people could just rely on lateral flows. Unfortunately, the reporting hasn't been as comprehensive as it has been. So I could give you some figures of what the cases look like in Kirklees at the moment, but I don't think it's accurate enough to be able to make that judgment. What it is worth saying is that the population level studies that are done suggest that about 1 in 16 people have COVID probably across the UK at the moment. But again, that's trying to take a number of people who report it through that study and extrapolate it up. But I suspect, I'm sure you all are experiencing at least some colleagues or some family or friend that have tested positive who perhaps, so you know it is quite significant in terms of the numbers of cases. I'm sure acute trust colleagues on the call will reflect that there is now an increasing pressure on our NHS system, as well as I suspect showing through into primary care as well. Predominantly people that have COVID but not necessarily are being treated for COVID. So people may have COVID anyway as in hospital or seeking medical treatment for another reason, and it's a coincidental or potentially a contributor to their illness, or in some cases it's people who are being treated for the effects of COVID. Critically, there is no increase, at least not at the moment, unless colleagues tell me I'm wrong, but the data I've seen suggests that levels of people within intensive care beds is not increasing as a result of the levels of COVID at the moment, which obviously reinforces the fact that hopefully the vaccination programme is stopping serious illness and deaths amongst our most vulnerable population, because the excess death figures are no different to they normally would be at this time of year across a 5-year average. So again, I think it'll be an interesting time going forward, and I guess the important thing for me is that people still get their vaccinations, so that even if you've never had one before, you can still go and get a vaccine now. It's an evergreen offer, so it's open to anyone eligible, and I would encourage people to do that. They will be about to launch the booster programme, so anybody in the over 75 cohort who've had their vaccine longer than 6 months can book on now and go get their springtime booster. And there are a number of clinically vulnerable groups who can also access that booster. So vaccine, I think, is key. I would also suggest that washing your hands is really important, and I know that you probably know that, but I think when we look at all the infectious diseases whilst we were dealing with COVID had gone down, it's because people's hygiene was generally better. So I would always encourage people to wash their hands. It's a really easy way of protecting from a range of infectious diseases. And I think obviously the tricky bit now is that we won't have access to testing in the same way. So it's difficult to know whether you have COVID or not. And clearly we know through, I suspect, lots of anecdotal stories that the symptoms people have experienced when having COVID have been really varied. So although there is still on the NHS website, it talks about the cough and the temperature. I know that my little boy, for example, he was sick. So it's like there are different symptoms that people experience. So I think that's going to be hard to manoeuvre, because what do you do? People will get sniffles for all sorts of different reasons, and it doesn't necessarily mean it's COVID. So from my perspective, I think the important position to take is if you have respiratory symptoms, if you're coughing, if you're spluttering, and if you're sneezing, then it could be COVID. So if you can, and you're lucky enough to be able to stay at home and isolate, then obviously that is an important thing to do. And if you can do that for 5 days, that would be brilliant. Clearly, that's not going to be the case for everybody. So my advice would be, if you need to go out, then think about wearing a face covering to protect others if you're sneezing and coughing, and try and keep your distance. And I suppose just think about vulnerability of the people that you might be around, because obviously we've all got some family members or friends who might be more vulnerable than others, and it's just about just thinking twice really about how we can protect the people that we care about. And just finally, from a health and care system, there has guidance been published last night about the testing regime that will come into effect for health and social care staff. They're still working through some of the specifics around that, but just to give some reassurance, there will definitely be an expectation that health and social care testing will continue, particularly, for example, those that work in care homes, etc. We will also be able to implement testing as a result of an outbreak. So if we had an outbreak in one of a setting, we would implement testing. And what that will also do is enable us to identify any potential new variants, because obviously there is still the risk that the current Omicron variant won't be the one that sticks forever. There's likely to be another mutation. So let's just keep an eye on when that happens. And we are still waiting for a few tweaks to the guidance, but hopefully we'll have a regime that we can support going forward. Still some questions to answer for me, I think, but clearly the important message is get your vaccine, keep washing your hands, and obviously if you have got any respiratory symptoms, just think about how you can potentially protect other people and stay at home if possible. Thank you, Chair.
Thank you very much, Rachel. That's really helpful. Anybody got any comments or questions? Oh, I've got a thumbs up. Oh. Bess, you have a question.
Thank you, Councillor Kendrick. Thank you, Rachel. Just on the evergreen offer for vaccinations, is it evergreen in the sense of that will be the new norm and that will continue forever, or is there expected to be a point in time when that would lessen off?
Apologies, I probably use that sort of jargony term. So I think one of the things with all these different booster rollouts is that there has been some evidence from some of our communities where they've said, oh, well, I never had my first dose, so if it's boosters now, I won't be able to go for it because I didn't get my first dose. So the concept of evergreen is to say that if you are eligible, you will be able to go and get your vaccine. I personally think they will keep that under review, but I don't anticipate that changing within the next few years. What I do understand, and obviously Carol as the lead across West Yorkshire for the vaccination programme will attest to this, is they're looking at how they build an annual potentially booster campaign in, which will link to hopefully things like pneumococcal vaccination and your flu vaccination programme. I mean, ideally, if they could get it into one jab or 2 jabs rather than 3, that's always going to be a bonus, because we know that it is difficult for people to access sometimes anyway. So if you can do it all in one go, it's a lot easier. So I think it will just be which cohort they choose for that, and that will very much be based on the continual assessment of risk from the various variants and how it's easily spread, etc., and the impact it has.
Okay, thank you. Baroness Caspian.
Well, with the councillor's hat on.
With a council.
Couple of questions, Rachel, around free testing or its demise. I mean, the testing, the price of the testing kits I've seen is, you know, I think beyond the means of a lot of people, given the other cost of living pressures. So, what availability is there for the council to provide some form of free testing where there's an outbreak in a place of work, or in a nursery, or that sort of setting, to try and put a halt to it? And then the second question is, my understanding now from the new guidance that if you go into hospital, you no longer need for an operation, you no longer need a PCR, and a lateral flow is expected before you come in. How much expectation is there that expected will work out?
Okay, well, thank you. And again, I will do my best with some of those, because there is a few unanswered questions that we would need to confirm. I think with your first question, I suppose the important thing to say at the moment is that even though tests have been free for however long they've been free and available, not everybody does them. So there is quite a chunk of the population who wasn't taking advantage of that testing in any event. And I suppose if you think about inequality and deprivation, the reason that someone doesn't test is probably because if it was positive, they couldn't act on that because they don't have the means to be able to self-isolate. So there is already an inequality in who is testing. So the removal of free testing, to a certain extent, it will be interesting to see how it plays out, because I think you're right, it presents challenges, but not everybody's currently testing. So it's not like we're going for something that everybody's doing to then nobody being available for it. In answer to the sort of role of the council in outbreak, so any time we have an outbreak of any infectious disease, we have an outbreak response. And don't forget, an outbreak is more than 3 or more cases, so it's not a lot. So if we were to find 3 or more cases within, for example, a care home that we could say were connected because the people were in contact with each other, then we would have an incident management team and we would determine the best possible action there. And for me, where we found that most successful is we'd put PCR testing in, because what that does is it sequences the test to see whether that outbreak is because of a new variant potentially, or just because, it just helps us to get that evidence base. So we would have that at our disposal to be responding to a setting-based outbreak. So that could be a workplace, it could be our own staff, it could be anywhere. So the outbreak is the key there, which feels slightly reactive more than preventative, I suppose, if you were thinking about it from a broader public health perspective. But equally, that's why there is testing regimes in those more high-risk population groups and settings anyway, so that we can try and do that prevention as well as the reaction. In terms of the lateral flow tests on test to treat, colleagues on the call may obviously want to comment from their individual organisations. I think they will look at how they manage that within their setting. So there'll be their own infection control staff putting in policies that reflect best for their population. And I'm not sure whether it would be a supervised test or whether it would be done on your pre-op assessment, and it will depend on whether that's nearer or further away from your surgery. So I think it's obviously now the guidance has been published quite late last night. It's for the trust to look at how they implement that. But through the Kirklees Health Protection Board, which is a subcommittee obviously of this board, we would be seeking assurance that those plans are in place so that we can protect people when they go in for planned care.
Very helpful. Thanks very much, Rachel.
Thank you. I don't know if anybody else is wanting to speak. I'm struggling. I can't see the chat bar. When I go in, it doesn't show any listing at all. So I don't know if there are any speaking. Whilst I'm trying to figure that out, really along the lines of what Councillor Pinnock was saying in terms of, you know, no legal reason to self-isolate, but then we have paying for tests. And I absolutely understand what you're saying, that not everybody is using tests and what have you. But I suppose the worry then becomes the potential impact of the infection on some environments, like a nursery, like a school. And whilst there would be, you know, some interventions as outbreaks occurred, it's almost a bit the horse has bolted, you know, before you shut the stable door sort of feel to it. And I mean, we will see what occurs, won't we? We'll see how it pans out, but it does worry me. And, you know, there are lots of organisations and establishments that could be, you know, unable to function, you know, if we get sudden outbreaks of infection. But I take on board what you were emphasising to us about washing our hands, getting vaccinated, and if we've got sniffles, protecting other people, and all of us who are responsible, I'm sure will do that as such. I've not seen any other hands or requests to speak, so thank you very much for that, Rachel. So if I could move us, please, then on to item 7, which is the Director of Public Health Annual Report. And I think that may be Rachel and Owen.
It is. Thank you very much, Chair. Owen has just joined us. You can see him on camera there, and he's going to drive a presentation, if that's okay, which I will just talk you through. How much time have I got? Is it about half an hour?
Yes.
Okay, so I will get through the slides so that you can see them, and then obviously really happy to take questions. I might not be able to see, so if you could shout at me if people are wanting to come in, because I'll be looking at something on my screen while I'm talking. So I hope that's all right. I suppose the first thing to say is just all credit to Owen, who's worked really hard to get it ready for today. And I know there's been a lot of other conflicting things, so it's really appreciated. And also that this is a draft in that it's almost there, but there is a few kind of presentational issues that we just need to sort out. So assume it's the finished product in terms of content, but we might have to do a little bit of tweaking in terms of the presentation. So this will help today to see if there's anything that we need to fix as a result. First of all, to say that obviously last year's Director of Public Health Annual Report was on tackling inequalities, which felt really timely in terms of the pandemic and the impact that had in terms of exacerbating those inequalities. The focus this year is on the first 1,000 days, and for those of you who have been in Kirklees as long as I have will remember I do often talk about this in terms of the importance of this period of time in anyone's life. There is a well-established evidence base demonstrating the importance of the first 1,000 days of a child's development. That's from conception to the age of 2, and that has a huge impact on the outcomes for the rest of their lives. And actually, in terms of development, it's unmatched at any other time of life. The development that occurs in those 1,000 days is absolutely key. So we have the best start in life as one of our Kirklees shared outcomes. So obviously we wanted to focus on that in this annual report. Okay, so Owen, do you want to go to slide 3 for me? Oh, you're perfectly on timing there. So what we tried to do in the report is similar to the last year's one, which is to try and put it together in a slide set where we can summarise the factors that are associated with the best child health outcomes. We've tried to use some narrative from Kirklees families, as well as for those providing care and support to our Kirklees families, as well as the data to back that up. So just to try and look at it from, this is the issue, this is what our population is saying, and these are what the professionals that work with them are saying, to try and see whether there's some clear set of recommendations that we can take forward. And obviously I'm talking about inequality as part of the data that we are providing, because we know that not all groups in Kirklees are the same, and we need to sometimes do different things with supporting our different populations. So Owen, if you want to go on to the next slide for me. Obviously you're all part of the Health and Wellbeing Board, and I think you will all agree with me that we would never ever do any of this sort of work on our own as separate organisations. And I think that the work we do around children and families is one of the most cohesive working relationships that we've got. We've got an absolutely brilliant colleague in Locala who have just taken the Thriving Kirklees programme and made it their own, and the partners involved in that, as well as the NHS maternity services, as well as our public health team within the council. You know, those dedicated teams do a phenomenal job in terms of making a difference to our children and parents' lives. So I think this is very much a reflection of that partnership working, and I think it's really important to have that up front. Next slide, please. So in terms of being born in Kirklees, the headline numbers tell us that the general fertility rate in Kirklees is declining. Life expectancy is significantly lower in Kirklees than the England average for males and females. And we've seen life expectancy fall. And that's not unsurprising, I think, given the excess deaths we saw during COVID. And obviously we need to see what will happen over the next few years to that statistic. We're seeing the age of our mums increasing, so we have fewer deliveries to teenage mothers, and again that's very similar to what's happening nationally. We have a high proportion of babies born to mothers of non-white British ethnicity than perhaps across the rest of the country. But critically, those mothers tend to live in more deprived areas. So clearly, in terms of the factors that contribute to a healthy pregnancy, it's ensuring that those outcomes aren't affected by that deprivation. Okay, next slide, please. So just how the format of the report is put together. So we've got 5 developmental stages: preconception, pregnancy, labour and birth, infancy and toddlerhood. And for each development stage, we've put, as I said earlier, the perspective of the parent, the child and the professional, just to give you that flavour of how it feels. You can navigate in the order of the development stages, or you can look specifically at a stage if you want to think about, you know, a particular agenda that you're working on. So hopefully from a user perspective, it gives you the option to dip in and out in terms of the areas that you're interested in. Okay, Owen, next slide for me. Okay, so in terms of preconception, we've tried to talk about what good looks like. So we've tried to put 10 factors in each development stage that would essentially be the important 10 things that will have an influence on outcomes. So for preconception, that includes for mums and dads staying fit and healthy, eating the right foods, exercising, stopping smoking, and reducing alcohol consumption. Taking folic acid is hugely important, and I think that you know, some people take supplements, some people don't. Folic acid is so important during pregnancy, and ought to be something that every pregnant woman and thinking about conceiving considers doing. And then I guess the other thing is, as with anything, any pre-existing health conditions needs to be managed effectively by the appropriate health professionals. So it's really important that all of the checks are done and booking in early with maternity services to be able to do that. Next slide, please, Owen. Okay, so what do we know? So that's the data to support the preconceptions. So we do have, as that says, slightly less people in Kirklees taking folic acid supplements. It is quite a big difference, and obviously there will be inequalities within that, but clearly that's something we need to do with the providing healthy start vitamins and making sure that people take that. And as it says there, the inequalities in terms of age and deprivation is quite clear in that take-up of folic acid, which is why when we try and do healthy starter vitamins, we try and make sure it's done by inequality rather than it being a universal offer. Kirklees has a higher proportion of maternal obesity than national data, and the rate of obesity in early pregnancy has increased quite dramatically. So if you look at that 2018-19 figure of 23.6%, and then you look at the 2021, that's jumped to 35.9. So clearly that is a significant increase. We've been trying to do a survey. We did one in 2018 to try and get an understanding about women's health or perceptions about their health before pregnancy. And I think the challenge with this is that mothers were more likely to cease or reduce unhealthy behaviours, but partners were often seen to increase their unhealthy behaviours. So it's quite an interesting dynamic, is that, and I think that partners supporting the person that's trying to conceive or the pregnant partner is really important. Next slide, please, Owen. Okay, so this is an example of what I talked about at the beginning in terms of putting some parent perspectives in there just to sort of get a sense of, and these are all quotes from people. It's obviously where we've captured through that intelligence. And I think that for me, it's that how we get prospective parents to know about that Healthy Start vitamin scheme, how we can help people make those lifestyle changes. And there's a tool that we are signposting people to called Planning for Pregnancy, which is by an organisation called Tommy's, which helps people just focus on those things that they need to do. Next slide, please, Owen. So this slide is kind of the child's perspective, and what we focused on in this is the kind of importance about talking about relationships and sort of how that helps children to develop and understand the importance of good sexual health and relationship health as they get older. And you know, talking about the positivity around relationships, where to get information, talking to your parents is really, really important, and making sure that children have that opportunity to talk about that, so that any myths are managed effectively at the right time. So we've put that in there because it feels like that's a focus, certainly from talking to some of our children and young people, about making sure that they get the facts. And then that obviously helps in the future generations. Next slide, please, Owen. So this is perspectives from the professionals in relation to preconception, and we're talking a lot in here about the kind of system level actions. So the West Yorkshire and Harrogate integrated care system, and how they are trying to implement the set of public health recommendations that they developed in 2020 around local maternity systems, and how that can be increased to include the preconception period, because obviously in the past it's kind of something that kicks in, you know, your 12-week booking appointment in terms of how you sort of get connected into the system. But how do we support people earlier than that during that preconception period, and making sure that everybody has that targeted support where they need it. We also talk a little bit here about kind of genetic counselling, and how we can ensure that people are given the right information about the risk factors they may or may not carry in terms of choosing their path around family. And I think that having access to good information helps to manage any risk in terms of things like consanguinity and other factors that lead potentially to poorer outcomes in terms of disability or infant death. So it's a difficult topic of conversation, but an important one in terms of making sure people have the facts and the choices that are available to them. Thank you, Owen. Next stage. So the next stage follows the same path as we've had. So I'm not going to spend quite as much time on each stage because I could talk about it all day, and we don't have all day, sadly. And I obviously want you to have a look at this outside of this meeting, but I will just focus on a few things. So do you want to go to pregnancy and the professional perspective on that? So here I've talked, as you would expect me to, the brilliant work that we do at Anti-PAMS. Anti-PAMS is something that is very much based on that peer support model, in terms of people feeling unjudged and able to talk to people that they have commonality with about some of the challenges that they face in terms of pregnancy. And we've got a perspective there from one of our volunteers who does smoking cessation support for pregnant women, and we know that we've got some really positive success stories in terms of how people have been supported to make those choices and make those lifestyle changes that supported them to have a healthy pregnancy, and obviously when their children are born as well. So, you know, reiterating that peer support models here are really positive. And then through the Healthy Start scheme, which obviously is run as part of the Thriving umbrella through things like Yorkshire Children's Centres, is about making sure that we've got that deprivation lens, that inequality lens, at looking at how we support and target those vitamins to the people that are least likely to take them, and ensure that it's not just a case of here's some vitamins and thank you very much. It's a conversation about the importance of them and that people should be taking them. So again, some interesting stories there about some of the brilliant work we're doing here in Kirklees, but that we need to do more of. Okay, do you want to go to the labour and birth slide? And if you could just go to the data one, Owen, if that's all right. Okay, so I thought this one was a particularly interesting slide because if you remember in the report we did last year, we talked about the fact that the infant mortality rate has gone up quite significantly. And again, it's important to reiterate that infant mortality is one of those indicators at a population level that really gives an indication of the health of your population. So it is really key. And we know that low birth weight is a significant factor in infant mortality and actually in childhood morbidity. So illnesses, disability, low birth weight is something that we know is a common factor. So again, social inequalities in low birth weight, which will help childhood and adult health outcomes in the future. And we have 8.1% of babies having a low birth weight, which is higher than the England average of 7.4. And we've been consistently higher. So again, it feels like, although it's not a huge number, we still are significantly higher, and we need to do more to make sure that we can bring that down. With things like babies born via cesarean section, I struggle a little bit with this as a statistic because we're currently at the England average. And I think one of the most important things for me with any of this in terms of labour and birth is that whatever happens, that the mum, the family are kept informed about what's happening. There is a conversation about choices. There is a conversation when choices are no longer available because, you know, there is a risk and that babies need to be born, or there is some factors going on. And I think however a child is born, as long as it's born safely and healthy, that's the most important thing. So, but keeping an eye on things like cesarean rates just gives us an understanding of the midwifery system and how that's working locally. And in terms of new birth visits, we have our new birth visits done, as it says there, and it's really positive to see that COVID hasn't impacted on that in terms of that new birth visit, which is hugely positive. And that's so important, particularly in those first few days after your baby's born. Okay, Owen, do you want to go to the infancy slide for me? And I want to just focus here on the what good looks like. And I do think with 10 things, it always feels an interesting one because it's almost like, how do you priority within that 10? And I guess, you know, for different people, different things will be a challenge. I absolutely would mention the routine childhood immunisation schedule because that is so key in terms of how we get babies protected, and, you know, things like measles, things like all of those infectious diseases. You know, we know that when we have the right level of vaccination from a very young age, we are much less likely to see outbreaks of what is a really horrible infectious disease. Infant feeding, you know, how do we support mums to make the choice that's right for their baby and right for them? And it isn't easy. Feeding your child is really hard, and it's making sure people have the support and have the advice. And certainly the peer supporter model works so well in that, because it is actually somebody saying, oh, well, if you do this helped me, and it just makes such a difference. Safe sleeping practices, the understanding about some of the risks on co-sleeping, room temperature, etc. And I think mental health for me was the other one I wanted to pick up with this, because we know that, you know, postnatal depression, we know that well-being when you're particularly a new mum, it's a real change, and to the partner as well. So how can we provide that support postnatally to women who may or may not be struggling with mental health issues, and making sure that they've got access to the right support? Okay, Owen, do you want to go to, if we can just go to the data around toddlerhood, that would be good. Perfect. Okay. This slide, again, you will see on the left-hand side, our uptake of all the childhood vaccinations is really good. MMR, all of the others, we do very well. One of the things that I'm sure colleagues on the call will attest to, we have had such a brilliant set of data provided for managing COVID. Carol and I were on a call yesterday, and we were just talking about how do we use the fact that we got such good uptake data on COVID to actually look at our other Vaccinims programs, because you'll recall, for those that were board members pre-COVID, whenever I'd bring a report on uptake of things like MMR, we tend to get a Kirklees figure, and that was usually it. So you'd know that you were higher than the national average or lower, but you would never know what the inequalities were within that data. So Carol and I are really keen to try and make sure that we can get a similar level of analysis on the data around this, because I suspect, looking at what's happened with COVID, there will be a very similar pattern in terms of uptake of some of these, and that will help us better target in terms of getting and encouraging those communities to take that up if there are pockets where that's not happening, and address any access issues should that be the case. So I do think that is a really positive news for Kirklees, but I suspect, like anything that's a Kirklees wide figure, there will be inequalities hidden within that. So it's important that we be able to drill down and use that information. And I know that in the adults arena, when we've been looking at vaccine and screening uptake, we've done some really good projects within particular communities in Kirklees where we have got some of those myths busted. But again, you can only really do that when you've got the data to back up what what the problems are and whether we do have particular pockets that we need to address. But either way, it's a good news story, but let's try and learn from COVID and do more. The stats on the right are around kind of development, so children achieving a good level of development at 2 to 2.5. 82.2% is very similar to the national average, and I think that's great. But again, I do think that there's more work to do to be able to get that up, just because, as we've said with the whole report, what happens in those first 1,000 days is so important in terms of the outcomes going forward, that the more we can do at this stage, the more and significant that will pay off. Okay, Owen, do you want to go to the recommendations slide for me? Okay, so I'm still finalising this just to kind of make sure I've captured everything in. So again, a recognition here of the fantastic system we've got in place to support those starting or expanding their family, and how we can support in those first 1,000 days. And the huge amount of professionals we've got, it was actually quite hard to fit everybody on that was involved in this in one way or the other. I guess the key ones are, preconceptionally for both partners to lead as a healthy life as possible, keep any pre-existing conditions controlled as best you can, and folic acid. Pregnancy, again, looking after yourself, avoiding alcohol, staying active is really key. I think being able to move around, and I would always say, making sure you become familiar with your baby and your movements of your baby, and obviously seek help if there is anything that feels out of the ordinary. And then from what we know about kind of early years in terms of post-birth, try to initiate breastfeeding if you can, but equally do not beat yourself up about it if that's something that you can't do, because there are very different ways to bond with your baby. And although breastfeeding is obviously recommended, not at the detriment of other things like mental health, etc., make sure your child's immunised, follow safe sleeping practices, and take care of yourself as well. Just because you've had a baby, or it's not like you're not still your own person, and making sure you've got that support network in place is absolutely key for a successful parenthood going forward. Okay, so Owen, I think there's one more slide. Is there just to sort of, so there's a lot of references there, which I won't go through, and I've put on the right hand side in very tiny writing all the people that have contributed to the report, and as you can see, it's a real reflection of the partnership that I illustrated earlier. We're going to do a bit more tweaking, and as I said earlier, we're going to go through some final checks of the report. We're going to be using Prezi again, which is what we used last time, which is kind of that interactive tool, and both versions of the report should be available by mid-April, when we've got them all finalised and proofread and all that sort of thing. But I just wanted to give you, as the board, an early sight of this, and obviously take any feedback or comments either here or outside of the meeting. And like my offer last year, I'm happy to come and talk to any of your organisations in more detail about this. Thank you, Chair.
Thank you very much for that, Rachel. Very much like the infographics, etc. helps somebody like me grasp things quickly. So thank you. Karen Jackson.
Thank you. Thank you for that, Rachel. And I would like you to come and talk to our board, please. That's the first thing to say, because I think what's important here is as we talk about what we're going to do in the next stage of thriving, that we're all focused on the things that are going to make a difference in the start of a child's life. Because if we're going to look after whoever it is in their place where they live, actually giving somebody a good start in life is really important. So I'm keen to come to the board, but I'm also keen to continue to have the discussions about, and what does that mean, and how do we translate that into real tangible action that makes a difference for children and families. So keen to have that conversation with you, please.
There's an offer. Anyone else, please, with a comment or a question? I'm not seeing anything. Oh, Carol McKenna.
Hello, it's a comment really, it's not a question. Rachel, what I really liked about the presentation was at various points how it felt like we are moving away where sometimes there has been judgment placed on women throughout all of this process in terms of caesarean births and ability to breastfeed and numerous other things. And it was just really, really refreshing to hear you talk about, you know, actually what matters is the baby being born healthy. You know, how it arrives, you know, is a secondary consideration, if that. And I just think removing some of the judgment away from issues around feeding as well is just really, really valuable, because, you know, I'm sure at the end of the day, a healthy, happy mum goes an awful long way to a healthy, happy child, doesn't it? And mum's mental health is often affected, I think, by their birth experience and those early years when it comes to things like feeding and sleeping and whatever it might be. So I just wanted to acknowledge that, really, because I think it's important.
And if I may, I just want to obviously reference the Ockenden report that was published yesterday, and as a difficult read that was, I really want to reinforce you know your body and yourself best, and if you think something is not right, then you need to have the space and the support to ask the questions and to talk, because, you know, everything is scary about that time. So for me, it's always a balance here about what is the things that you can control and what are the things that you can't. And, you know, I just think the support you get is so critical in terms of making that a success. And for me, as you say, measuring it on whether it was a C-section or a, you know, anything else, why is that an indicator of success? It doesn't necessarily have to be, does it?
Yeah, absolutely.
Yeah, thank you very much. And Councillor Pinnock. Muted. Unmute, Kath.
You're on mute, Councillor Pinnock.
Sorry, I hope you can't lip read. I want to support what Carol said. Particularly, I think it would be good to pull out from that report any key issues that, for instance, different organisations around the table could take up. So, you know, there's an obvious one for the council, but there's also an obvious one with the council working with its schools family, and I don't know whether it's possible to bring that out at this very late stage, but I would certainly find that helpful to say, right, here's something that we could work on a bit to try and make those small improvements that would just make next time you report it was gone in the right direction. But I'm having looked at the Ockenden report yesterday, it was horrible, scary stuff. So yeah,
I think absolutely brilliant suggestion. I mean, the way we've sort of handled it last year is that when I went to Locala's board, for example, I'd tailor the recommendations to suit that kind of organisation, and it's always a bit of a balance, because as a board, I know we want everybody to care about all of the determinants of health, not just what their organisation is responsible for, but at the same time making sure they're doing what their organisation can do. So I think we can do both of those things. But yes, and clearly through the JSA, which Owen will talk about, that's how we monitor some of these on a regular basis. But what this report does is give us an opportunity to call out some of the things that we want collective action on. So yeah, I'll pick that up, Kath. Thank you.
Anyone else? Not seeing anything else. So can I point members to the recommendation on page 12 in your pack, which says it is intended that board members will make use of the DPH report to inform decision making and commissioning to help reduce health-related inequalities and improve early years outcomes. And there's a promise there then that static and interactive versions of the report will be made available to enable the report to be shared as widely as possible. So are we all happy with that? Yes. Thank you so much for that, Rachel. I think that's a really, really good report and an interesting discussion. Thank you. Could I move us therefore quickly on, and Rachel's already referred to this, agenda item 8, which is Kirklees Joint Strategic Assessment Update. And I understand Owen Richardson is going to take us through this. So over to you, Owen.
Thank you. Thanks very much, everyone. Yeah, so I've got 3 quick items on the agenda that I'm going to go through. The first one is the Kirklees Joint Strategic Assessment and update on that. So just to say, firstly, with the pandemic, we've been focused on other things over the last 2 years, understandably, in terms of response to the pandemic and supporting people through that. So we've not had chance to keep the KJSA as up to date as we would have liked to have. We know that kind of regular work is now picking up again, and people are looking to the KJSA for some up-to-date intelligence, local intelligence, to inform commissioning decisions and so on. What I'm proposing is that we temporarily archive the out-of-date content that's on the KJSA website and replace it with a ready-made profile that was produced by the Local Knowledge and Intelligence Service, the team within the Office for Health Improvement and Disparities. The data within that profile mirrors to a certain extent, or to a great extent, the format of the content of a JSNA or our KJSA. It's got sections about the various different factors that we would be looking at within our KJSA. It's got local authority level data, so it's got Kirklees data in there, and it's got comparisons with the region and with national figures as well. So my proposal to the board is that we temporarily replace the content, so we archive the old content and put this in its place, this profile in its place. And in the meantime, in the background, we've got a steering group, a KJSA steering group, who will work on a design of a new KJSA site. So we'll look at what sections we want to include in a new version going forwards, and then we'll start to update that. So we'll refresh all the data, and we will publish a new version in due course. So that's my first item.
Okay. So anybody got any comments or questions on that? Yeah, your report did make me go look at the KJSA site, and yes, I understand exactly what you're saying. So if there are no comments or questions, could I ask the board to agree to endorse and support the proposal that Owen's made to replace the KJSA site content as is described, to archive the old stuff and put in the new? Yeah, I think I'm getting a lot of nods ahead, so thank you very much for that, Owen. That's
thank
fine.
you.
So if we move to the next one then, pharmaceutical needs assessment update, is it?
Yes, so just to give you a very brief update on this, we've been working collectively across West Yorkshire. The 5 local authorities, the public health intelligence teams have been working together. We've pooled our resources to to work collectively on our P&As where we can. Obviously, they'll be bespoke to a certain extent. They'll be tailored to each local authority's needs. We're almost in a position now where we would like to sign off a draft version of the P&A. In order for it to go out to consultation, it'll need to go out for a 60-day consultation, and then we'll get feedback on that draft. And then the intention is we publish by the 1st of October is our deadline for publishing the new P&A. So it's just to give you a heads up that we're almost ready to share that draft with you. And if the board could look at that when that comes through and sign that off ahead of that consultation period, that would be fantastic. Thank you.
So could I ask when do you envisage the consultation process starting?
We're looking at probably mid to around mid-April, I would say, maybe slightly later than that. But it's a 60-day period, yeah. So that still gives us plenty of time at the other end in order to make any changes and publish. Yeah,
it's just I'll look to Phil and Jenny to sort it out, but because we won't have a board meeting to formally do something, I assume, within that time period, but I'm sure we'll sort that out afterwards. Anybody got any questions or comments? Just for information. All right, thank you very much. So, keeping going, we've got the click survey update.
Yep. So yeah, my third and final one is the click survey. So just to give you a brief update on where we're at with that, really, the click survey. So this is our adult population survey that we run periodically, usually around every 4 years. So that survey ran from November through to December 2021, and we're just in the process at the minute of we've got some of the data back. We're just finalising some headline summary reports, and then we'll go on and do further analysis as well. And we're just putting together a programme of how we're going to communicate that. So who that goes out through. But yeah, it was just, again, it's just to give you a heads up that information is coming soon. The survey was done, we had around 6,000 responses to the survey, so we've got a good sized data set, and it's going to give us some really useful insight, I think, at a local level that all partners will be able to use.
Yeah, any comments or questions? Not seeing any. I have to say, when you look at the recommendations in the report, it asks us to support the survey by utilising and promoting the summary reports and findings, but also attending or sending a representative to the CLIC workshop. So if we could all bear that in mind, let's do the advert for that, Owen, while we've got the chance.
Thank you, Councillor Kendrick. That's really useful. Yeah. So we're about to, or we're looking at what we can do in terms of a workshop, just in terms of getting people involved and engaged with the content of the survey and how people can best use it. Obviously, we've spent a lot of time and effort doing the survey, and we want to make the best use of those findings.
Absolutely, absolutely. I think the CLIC survey is absolutely invaluable information that's of real use to everybody as such. But we'll now conclude the Owen Richardson Roadshow, but thank you very much for that, Owen. Really well done.
Thanks very much. Thank you.
Yes. So if I could move us then, please, to item 9, the Adult Safeguarding Annual Report. This is a report, as it says, comes annually to the board. And we have 2, I think, people here with us today. With Rob McCulloch-Graham, who is the independent chair of the Safeguarding Adult Sport for Kirklees, and Mike Houghton-Evans, the former independent chair of the Kirklees Safeguarding Adult Sport. So I don't know who's going to start or I'm not in the lobby, and I'm just to admit.
Councillor Kendrick, I've just noticed Rob hasn't managed to join the meeting yet.
I think he may just.
Oh, he has just here now, yeah.
Yes.
I can see he's appeared at the bottom. I'll leave it to Rob then.
So that's a bit much. Of course, I'll just come into the meeting and you've thrown him under the bus, Mike. Well done.
Thanks, Mike.
So welcome, Rob.
I've put it to him before.
Thanks very much. What am I on? Any other business now?
No.
No, right. Kirklees Safeguarding Adults Board Annual Report.
Okay, thanks very much, Councillor Kendrick. Thanks very much, folks, and I'm delighted to bring the report to you this year. I'm also delighted that Mike's agreed to actually come, and I thought it was really poignant to ask Mike to join us, because he's really steered the Kirklees Safeguarding Adults Board into the position that it is in just now. So I've been in post just short of 12 months and coming in after Mike, and I'm pleased just to report, before we go into the annual report, that the work that's been done by the team, the partners, and by Mike himself is outstanding. I've been on several safeguarding boards in my career, not as chair, but I've been involved in at least about 4 of them. This has to be the best that I've been on so far. So to the partnership now. We still deal with the same challenges, however, and those aren't going away. So it's still a difficult role that the board has to play. And I'm delighted, however, that we are in such a strong position to be able to address some of the issues that we have to face. Now, the paper itself, the report, has already gone to the Council's scrutiny panel, and Councillor Khan was present there at that time with there, and the scrutiny panel were to note the paper. It was there for their information, but it's come here for your acceptance as a statutory duty that the board has to fulfil. But I'm going to pass to Mike now, and he might want to give some words from his time here and for the report, which was done during his tenure as chair of the board.
Okay, thanks, Rob, and thanks for the kind words and the checks in the post. I think well, it's nice to see you all again. I wasn't expecting to be here today, but I was asked to do it, so that's fine. And it just proves that you can take the man out of Kirklees, but you can't take Kirklees out of the man, by the sounds of it. The report is the usual one you get. You'll see that for those who perhaps haven't heard this before, we've worked very hard during my period as tenure to make sure that the Safeguarding Adults Board is seen as a true strategic partnership hosted by the local authority. It's not a direct function of the local authority like other boards. And we've used that position really to make sure that we have really good engagement from the partners. Partners chair all the subgroups. They're very involved and active in taking forward the board's agenda. And I think we're particularly proud of the contribution we've made from the adult board perspective to engage with those other strategic partnerships in Kirklees, primarily children, community safety, and of course yourselves. And that's produced some that agenda has to be, I have to say, you can't take your eyes off the ball on that one. It's quite natural for boards to sort of strive and prioritise their own work, but of course the real strong message is you achieve your work through collaboration, not through isolation. And so that's the motivation behind that. The only other thing I'd say is you'll see in the report we did hold, before I finished, the challenge session. And we do that every year where members of the board meet with myself and the lay member, and we lay down some challenge questions really about what are we doing well, what do we need to do better. And that was particularly useful session midway through the pandemic, because what we had done through the pandemic was develop a risk register, if you like, of those areas we thought safeguarding needed particular attention. And the conversation at the challenge events was very much focused around what people refer to these days as the new normal. What's going to happen as we come out of the pandemic? What can we think is a good thing, and what do we need to worry about? And those who know me know I always focus on what might be the unintended consequences about those good ideas. And I think one of the main areas that I think came out of this was the idea of this blended model, this blended approach that's being projected about triage, particularly when somebody's trying to, get advice and access a service. I suppose during the pandemic that became particularly pertinent for general practice, but I think it applies to all of us. And in the questioning, put it to people about, okay, you can have a blended system, you can have a kind of remote way of triaging and deciding who should be seen, if you like, and who can be managed differently. But the question is always, how do you do that? And how do you do it without falling into the trap of creating a checklist? Because a checklist actually could take away your professional judgment. Ticking boxes is not the way to do it. And we really laid down that challenge. And I'd say that is an area from a safeguarding perspective. I know Rob agrees with this, that the board needs to keep its eye very closely on as to how that blended approach does not lead to unintended consequences where risks are not identified and not managed. And of course, as a man, just focusing on the NHS bit, I'm not really having a go at the NHS, it applies in other ways, but as a man, I'm very reluctant to go to the doctor. And when I do go, it might be for something that I end up leaving saying, well, actually, you've got this mark on your head you didn't spot. You need to do something about it. It's those are the kind of unintended consequences. But anyway, I've laboured that point. But generally, the commitment that came through the challenge session was to carry on and do better than we've done, carry on with that collaboration, that joint working, that partnership way of working. And that was a very strong theme, a very positive message that's come from the partners. My final point is Kirklees has an excellent workforce. The Safeguarding Board is really well supported by Jackie and her colleagues who are you couldn't ask for better. They are, Jackie, you can smile. And so Rob's right, he's entered a job where he's very well supported. And all I can say is there's the annual report. It was my annual report because it was written before Rob arrived. So if there's any questions, I'm happy to deal with them.
Colleagues, thank you for that overview. Any questions or comments, anybody? I'm not seeing any at the moment. No? No? No, nobody wants to question you at all. So gracious me.
It's not that frightening, am I? Yeah.
I have to ask board members, we have to officially receive this annual report as well as valuing it and using it. And the comments about the strengths of the partnership and the strengths of the Safeguarding Board are heartening to hear. I would particularly like, and I have known you an awful lot of years, Mike.
Yes.
I would like to say thank you so much for your commitment to Kirklees. I think you've helped us and moved us along so much, and I'm very, very grateful for your work. I know we're in safe hands with Rob, but I will miss seeing you, but there we are. But thank you so much for your work.
Yeah, maybe our paths will cross at some stage again, Vivian.
Yeah.
We'll see. Okay.
Perhaps so.
Thank you very much. Thank you very much.
Pleasure. So, board members, I'm looking, we're all happy to receive this report. Yes, nodding heads. Thank you very much. Gentlemen, thank you both very much for that.
Thank you.
Thank you. So if we could move on then, colleagues, so it must be item 10 if my counting is correct, which is the transition to West Yorkshire Integrated Care System and Kirklees Place-Based Partnership. And it's Carol McKenna is going to help us with this.
Thank you. I'll probably be quite brief on this today, actually. I don't have any slides. I'm just going to give a little bit of a brief update. So just to recap a little bit, when I was here last time and looking back at the minutes as to what we covered, just to remind people that we talked about the transition stages because of the delay to the Health and Care Bill. So we are still working on the assumption and the hope that that will get through Parliament in time for a 1st of July start. That's the revised target date. Interestingly, actually, had we been on the original timescale, today would have been the last day of the CCGs and would have been moving into new arrangements tomorrow. But clearly that's not the case. So however, we are very much working in shadow form. And that I'll say a little bit about that in a moment. So if you remember last time as well, I talked a little bit around things like the fact we decided on the name of the partnership. We were working on a collaboration agreement to support the place-based partnership. And we were just about to embark on the recruitment process for some of the independent posts on our committee in Kirklees. So just a quick update on a few of those things. The work on the collaboration agreement continues. It's not complete as yet, but we've got another update on that coming back to the partnership forum next week. I think if I probably said last time, the collaboration agreement is very much a document that underpins the way in which we're going to work together as partners. It's not a legally binding thing, and that was a strong view of the partners that it shouldn't be legally binding. But it's about how we will operate, about the spirit in which we will work, and the values that will underpin our local partnership in Kirklees. So I'm hopeful that will get to a conclusion fairly shortly. We have also almost got to the end of the appointment process for the independent chair of our committee of the ICB in Kirklees and our independent members, and still we have preferred candidates for those roles and working through the usual employment checks and what have you. So we'll make announcements on them in due course, but I'm pleased that we had a really strong field for those posts. And then just the other thing to mention is that you may remember when we spoke to you before that the ICB committee in Kirklees, as well as having these independent members, would be made up of a number of partner members. So that's people such as the council, the trusts, Locala, the Mental Health Trust, General Practice, etc. We're now in the process of confirming who the representatives from those partners will be on the committee, and we're almost at the end of that as well. So it's our intention that we will start to hold shadow meetings of the committee in Kirklees from next month, from April through into June, with the focus very much being on development. So that'll be about people getting to know each other, understanding what the role is, probably a fair bit of information sharing and talking if I'm honest. They won't be able to, the decision-taking element of it still sits with the CCG until the end of June, and then moves into the ICB, after which much of that will be delegated back into the place. But feels like we're making good progress now in establishing the arrangements that we'll need to actually run our place-based partnership. And I'm conscious that update today has been quite focused on the sort of nuts and bolts of running the partnership on the groups and the meetings, but it's underpinned by a sort of what I would say is an ongoing, really strong partnership approach. We've always said we're putting these arrangements in Kirklees to build on what we've had already in place and the strong partnerships that exist, and that remains the case. So I think maybe I'll just leave it at that today, Chair, if that's okay.
I think that's fine. Thank you very much. Anybody got any questions or comments? You're all very quiet today. I'm not seeing anything. So thank you very much for the update. I think it's a huge advantage for the shadow form board to be able to spend some time before having to go leaping into activity, and I think that will be an invaluable strength for it. But thank you very much for that. Okay, and then if I could move us then please to agenda item 11, terms of reference and membership for 2022-23. And Phil Longworth will be just taking us through this, explaining this to us. Over to you, Phil.
Thanks, Chair. Again, this is just a verbal update because as Carol's mentioned, we had been working on the basis that we need to revise the terms of reference for the board and the membership in light of the introduction of the changes in the introduction of the Integrated Care Board for this meeting. However, clearly that is not the case because the board, Integrated Care Board, now won't come into play until the 1st of July. So just to reassure board members that we've been keeping abreast of developments. There was actually a session on Tuesday afternoon of Health and Wellbeing Board support officers across the region, and all Health and Wellbeing Boards are in a similar position where everybody's recognised the fact they need to update the terms of reference and the membership of their boards to reflect the changes, but everybody's just trying to work out how they can do that to make sure that we only change the terms of reference once as opposed to multiple times. So we're keeping working, I think, keeping abreast of the changes that are happening across the region, and we've actually created an initial draft terms of reference, revised terms of reference that we've shared with a few officers who are involved directly in the changes. And prior to the meeting, by coincidence, the first meeting of the Health and Wellbeing Board in the new municipal year will actually be on the last day of June. Again, is the day before the changes are scheduled to come into place. So we need to do a bit more work just to make sure that the draft we'll be sharing with people reflects the legislation. So we need to wait until legislation has actually been passed. As soon as we've done that, we'll share a version for board members to comment on, with a view to bringing it back to the first formal board meeting in the new municipal year to actually get a formal agreement to recommend to the council to update the terms of reference and the membership, because it is actually council decision to change the terms of reference of the board, because this board is actually a subcommittee of the council. But the council can't do that without having had the input and contribution of the board. Work in progress.
Thank you. So that means the terms of reference and membership won't be dealt with at the annual council meeting, then it will have to be a council meeting following the first meeting of the Health and Wellbeing Board in June.
Yeah, so we'll be working on the basis that the membership will stay as is.
Yes.
But that will actually only affect one meeting in the new municipal year, and we will need to change it subsequent to that, because obviously the CCG, for example, won't exist post July, so we will need to update it then.
Any comments? Are we all happy with that? We all understand that? I think we have come to the end of the agenda for today. I have to say, there is talk, whispers in the corridors of power, or Phil Longley suggested to me, that when we meet again in the new municipal year, it potentially will be a meeting in person. I have asked if we could consider and look at whether it can be hybrid, because I just do think that helps a lot of partners who are very busy to participate. But I am told probably if it is in person that board members will have to be physically present, but there'll be information about that as we go along. And also the meeting dates for the municipal year will be confirmed after the council's annual meeting in May. And the date of that I can't remember. Is it the 20-something of May? Anybody know?
Yes, I think it might 20-something of May. I can't remember the exact date.
Yeah, I want to say 26 or 27. It's late May when the annual council will occur, which will confirm dates for the Health and Wellbeing Board for the next municipal year. So unless anybody has anything else to raise, ladies and gentlemen, can I thank you all for your attendance? Thank you for the contributions we've had and the presentations we've had, and say the meeting now comes to an end. Thank you very much. Bye-bye.
The 19th of May, annual council.
Thank you very much, Chairman. Thank you. Bye-bye.